Thank you, Vidya, for hosting and doing an extremely good panel discussion. Now, if I can call upon the multi-speciality team, if I can call Dr. Velayudham just as from endocrinology point of view, and call upon Dr. Murugesh, and Dr. Ramdas sir, please come. And who else is there? Nephrology. Dr. Mangal, please come. And Dr. Arun, please come. Respiratory. So I think we got an extremely good crowd now. Almost 70 doctors are here. So well, we can stand. It will be a very quick one. Dr. Mangal, please come. Come. Very fast. We'll go in 5 minutes. Come, Dr. Mangal. You got a phone call. You can come in between. Please. Now, so for last an hour and a half or so, we get an exciting discussion about this molecule. First, we started with pathophysiology of type 2 diabetes and how the thing of insulin secretion, insulin defect, the whole lot is changed by different. So I think we had an excellent description by Dr. Tyagarajan, who went through the pathophysiology in a nice way. And then we had the importance of cardiometabolic discussed with Dr. Ramraj. And also after that, I think Vidya has given about the molecule, which is the game changer, which has made a huge impact already in 2 months of launch. I think it made serious amount of money, but it's not only that, but the people started using it in the clinical practice. Dr. Venkatesh was saying the real world evidence is coming out, and once the real world evidence is out, and if it matches with the RCTs, nothing like it. And I think on personal note, I've used quite a lot, and the effect is brilliant, and there are a lot of small challenges in terms of using as a oral molecule. But I think in practical point of view, in future it has to be that we have to use these molecules as a team. The days are gone. For example, we just want to start on metformin, and being a diabetologist, just put 1 or 2 drugs and that's it. But here, being an expensive molecule and also a molecule with multiple pathology and multiple way of action, if you like. So if it goes through a team, and because it addresses the whole lot, it addresses the whole lot. When the weight loss comes down, and Dr. Arun comes into play with obstructive sleep apnea, and Dr. Murugesh comes into play with when the weight loss is happening, the fatty liver improves, and Dr. Ramdas will come into play when the HbA1c, the efficacy of the drug comes with weight reduction, the stroke risk and other things will come down. So we got the whole perspective of a molecule where the multidisciplinary team has to be involved. Now, with that note, it's all going to be one word thing that I want to ask. How do you see this molecule? I'm not here to talk about just a molecule, but it is just the class of a drug which is injectable available. I can remember the days that 2009, I was there for launching liraglutide in Surrey, but now in 2022 launching this thing. It is a pride moment, and it took so many years for a drug to convert injectable to a oral drug. Now, how you have seen this drug in terms of a GLP-1, if you have got an experience of using it, number one, and number two, have you seen doctors using it in the past? And if it is an injectable one, and what is the difference, or what are the things that you like about this drug which you may use it or you might want to suggest to your patients, Dr. Ramdas sir?
No, this may be a game changer in the management of patients with the neurology disorders. One thing, I haven't seen this molecule because we used to see in the conferences people they used to present in movement disorders, the glucose transport, the glucose transport, one of the impairment in movement disorders. But I started looking into this molecule once I was asked to be a panelist.
Analyst.
Otherwise, I may not have looked.
Exactly. So this is the point. So the specialist, this is the exact thing I wanted from him. When it's been already there for more than 10 years as a molecule, and now he's saying that this is the exact scenario of the whole thing. It is being managed by endocrinologists and diabetologists for a very long time. Now being available as a oral molecule with the multidisciplinary team, whether we should try to get involved the team and also try to use in more patients. So thank you, sir. That's what the exact point I want. You want to mention anything else or very quickly?
No, that's what the spectrum of disorders that this molecule can be used is totally all the complications of diabetes can be managed.
Sure.
The polyneuropathy, stroke,
micro and macrovascular
everything almost it can be used as a panacea for the alternative. It's working at the molecular level.
Sure.
So it can be tried. They ask most of the people has mentioned about the cost factor is really will have a say. But in future it may come to a play in a big way.
Sure. Dr. Murugesh, very quickly, so you got your patient with fatty liver and that is progressing to NAS and NAFLD and probably you're ending up in cirrhosis even without them having an alcohol intake. And you see that there is not much of medications available. And for NASH and NAFLD, we haven't got much of drugs at all. In fact, there are 1 or 2 drugs that has been in the pipeline, saroglitazar has been tried and other things. But if you have got a drug where the weight loss happens and probably the fatty liver improves, what are the type of patient that you're in your mind that you might want to use these group of drugs because it's orally available?
Speaking at present, we don't have any effective drugs in controlling fatty liver and NASH. Only approved drugs is the vitamin E, UEON and pioglitazole. That also not proven much effective. And recently on saroglitazar, that is hypertriglyceridemia with NASH, some beneficial effect is there. Probably with the introduction of this oral semaglutide, probably with good weight reduction and reduction in fatty liver, NASH, may hope maybe future is
sure.
Good.
Thank you, sir. That's very, very useful. Now, being a respiratory physician, Dr. Arun, now if the weight loss happens and empagliflozin and SGLT2s have got extremely good data now with improving the sleep apnea. Now, it is no-brainer that when the weight loss happens, then the obstructive sleep apnea improves. Now, how do you want to see OSA as a metabolic disease than a respiratory disease? I'll just put you straight in the point. I don't want you to get into the drug, if you can. Thanks.
Right. Thank you for the question. So, whenever we imagine a patient with OSA coming in, we imagine a PQV, a stout patient coming in with all sorts of metabolic and cardio complications, whatever possibly you could imagine. Now, this is a patient we are going to put them on a positive air pressure therapy. And the first question they're going to ask is whether they have to be on the positive air pressure for the rest of the life.
Absolutely.
So this is going to be a game changer in that sense. The patient is going to get better in the sense the OS itself, the AHI, the hypopnea index is going to come down in a marked way with the perceived weight loss and with the reduced risk of all these metabolic complications.
Thank you so much.
And then another complication of diabetes, the diabetic lung disease itself is well documented.
Yeah.
So I see in the long run, with the drug becoming economic, might get even better. So so it is going to be a game changer in that as well.
Dr. Mangal, are you willing to come? Dr. Mangal? No, he's there. He's got a phone call. Okay. Now, just to conclude, Dr. Velayudham, being a clinician who's so much experience and endocrinologist, very well trained, you've seen a lot of drugs and comes and goes in your career, and I'm talking about anti-obesity drug of serotonin uptake inhibitors, or I don't know, the recent one, whatever it is. How do you see this molecule? Not because it's a novo organized or it's a launch of a drug, but I want you to come up with your own experience and just tell how it will be a game changer, or how do you think it's a game changer in the first place, and do you think whether you would use these kind of drugs in future more? That mic is not working. Mic work. Right, okay.
See, setting aside the non-glycemic actions and non-glycemic benefits of this molecule, this was mainly designed as an anti-hyperglycemic drug. So, in that aspect, it does its job. So, it has been there as an injectable drug in the West, but so in our part of the country, it has been recently introduced. So, it's still in a toddler stage as far as our clinical practice is concerned. So, even I have a handful of patients who are on this drug, so I need to know how do they do and how do they sustain with the continuation of drug. As during the discussion, I was telling about the cost of therapy. Many patients, they get initiated with a particular form of drug, and due to cost restraints, they discontinue after some time. So we really do not know the long-term effects or benefits in a particular patient. So this is in a toddler stage. I think it does its work fantastically, and so it should grow as a healthy child.
Now, I think that you mentioned a point about the cost. Now, that the data of people continuing for 2-3 months and stopping it is also very important for India, because we need to know what percentage of people are willing to go for the drug, and the cost is the main factor. They tried hard, but they cannot sustain it. It's not whether it's due to the drug intolerance or whether it's a cost. It will be interesting to know. So it's only when you get this to use these drugs more. We are getting fabulous data in Coimbatore. So hopefully, under ADA in New Orleans in 2 weeks' time, we'll get more and more data coming in with semaglutide. And the injectable semaglutide is extremely interesting molecule, and I think it has done wonders in terms of weight loss. It is like a molecule waiting to come, sort of thing. So that is the story of semaglutide. And with that, I think I will call upon Dr. Priya, if that is okay, or will inaugurate well. We'll do a small kutuvalakku, and can I ask Dr. Ramdas sir to come just to light up the lamp, a senior person, and Dr. Arun, please come. The owners will be called as well. So, Dr. Arun, please come, and Sir Wanga. Dr. Murugesh, please come. 4 will come. Dr. Vidya, please come.